This is our IDU video. We'll be looking at diabetes in Singapore by Zihan, Yihan, and Yunnong. Diabetes was first detailed outlined by Areteus of Cappadocia in the 2nd century AD. It's a non-communicable disease that has 4 different types, which are type 1, type 2, pre-diabetes, and gestational diabetes. Type 1 is caused by an autoimmune reaction, which means that the body attacks in error. This will prevent your body from producing insulin that helps transfer glycemia into energy. Symptoms of type 1 are feeling very tired, losing weight without doing anything, and feeling thirsty. It's mostly occurs in youth and is a genetic condition that often appears early in life. 90 to 95% of patients have type 2, which occurs when insulin in your body is not properly controlled and cannot maintain normal blood glucose levels. It often occurs in adults, but more in children, teens, and young adults. The symptoms of type 2 are feeling thirsty, increased hunger, and blurred vision. While it can be prevented by healthy changes in daily life, such as consuming healthy food like vegetables and exercises. In this video, we will be talking about type 1 and type 2 diabetes.
Singapore is a sunny tropical island in Southeast Asia, off the southern tip of Malay Peninsula, an urban country. Singapore has excellent finances, a high degree of openness, highly dependent on international trade, and the GDP of Singapore is $378.65 billion, which is very high. Singapore is democratic republic, meaning the state operates on principles common to republics and democracies. They vote to choose the leader of the country. The population of Singapore is 5,954,162. Life expectancy is 84.07 years old.
Main ideas that we'll be looking at are the risks that diabetes brings to human life, what problems it causes, and how to solve the problem. In Singapore, for every 9 people, there is 1 person who had diabetes, which is about 10% of the population. A good way to solve the problem is to use medications. One way is to inject insulin, which most people with diabetes use to treat. They need insulin therapy because diabetes patients cannot produce insulin on their own. The other way is to take medicine like glimepiride.
Social impacts of diabetes in Singapore is over 400,000 Singaporeans live with diabetes, and the risk of Singaporeans developing diabetes in their lifetime is 1 in 3, and estimated that by 2050, more than 1 million people will get diabetes. Singaporeans are more likely to get diabetes due to diabetes risk. The 2019 Global Burden of Disease report for Singapore states that 26% of the diabetes burden is attributed to diabetes risk and 50% to overweight. Almost 430,000 or 14% of Singaporeans aged between 18 and 19 have been diagnosed with pre-diabetes because their blood glucose levels are higher than normal.
Now let's talk about the economic impacts of diabetes in Singapore. According to the National Library of Medicine, in 2010, the cost of a working-age patient is about $5,646 per year, and now the cost is definitely much higher than 2010. $7,791 for 1 patient cost per year in 2050 to cure diabetes in Singapore was estimated. For those patients with a low income, the cost for them to cure diabetes is not a small number, and they have to spend that much money every year.
This
This can be a huge problem for most of the families in Singapore. The total cost of diabetes in Singapore for working age population will increase to $1,867 million in 2050. The total diabetes-related economic cost in Singapore is about 0.35% of Singapore's GDP. It's not a lot by just looking at the percentage itself, but the total cost of health care is only 4% of Singapore's GDP. And we can see diabetes is really a big problem in Singapore.
There are over 400 people who have diabetes in Singapore. People with diabetes have a lot of limitations on food and drink. The food they eat cannot have a high sugar like rice. In a survey by National Nutrition found that Singaporeans consume about 60 grams of sugar every day, which is higher than the recommended daily intake of 50 grams of sugar. And this might be a huge cause of the high rates of diabetes in Singapore. Second, the people with diabetes have a requirement of good environment, because natural environments such as smoke can also negatively affect people with diabetes. The pollution concentration in Singapore is 8.6 milligrams per cubic meter, which is very low. So this is relatively positive impact.
Treatments for type 1 are insulin injections or insulin pumps, which move sugar from the blood into other body tissue, so it can be used for energy. It also will stop the liver producing more glycogen. Insulin is generated in isolates of Langerhans. There are individual clusters of cells specializing in the pancreas. Insulin acts with glucagon, another hormone produced by the pancreas, to control glycemia. Frequent blood sugar checks and carbohydrate counting is also a type of treatment to manage your blood sugar level. Healthy diets such as fruits, vegetables, greens also can help to lower the risk of getting other diseases, strengthen the body, and boost the immunity system. For some people, pancreas transplant or islet cell transplant would have a significant effect on them.
The treatment for diabetes type 2 is very similar to type 1 diabetes, but there still have some difference between them. For type 2 diabetes, the patients can use diabetes medications as a treatment. Metformin is one of the most important medications for diabetes. It's the first medication prescribed for type 2 diabetes. Metformin can reduce glucose production in the liver and increases the body's sensitivity to insulin, and allow the body to use insulin more efficiently. Some people are B12 deficient and may need to take supplements, but it can also cause some effects include diarrhea and abdominal pain.
The similarities of type 1 and type 2 diabetes is they both can be treated with the insulin. Type 1 diabetes is due to the lack of insulin, so long-term use of insulin. Patients with type 2 diabetes have poor insulin function, so they are more often treated with drugs. Type 2 diabetes is more common. Type 1 diabetes is caused by the destruction of the insulin-producing beta cells in the pancreas, so insulin is needed to treat it. Type 2 diabetes is caused by cells in the body becoming resistant to insulin, because these cells don't have interact with insulin in the normal way, so the cells don't get enough sugar. This is why both types of diabetes need insulin.
In Singapore, there is a product called the Freestyle Liver System. This is a system for glucose monitoring in children and young people with diabetes. This is easy to operate. You put it on the back of your upper arm to check your glucose. To check it, you must scan the small sensor with your phone with the app. This doesn't cause any discomfort under the skin. Positive of this is that it works and you don't have to worry about checking your glucose with a blood sugar meter that is not inconvenient to bring outside. In a study by Abbott Diabetes Care, 93.4% of patients agreed or strongly agreed that there was no discomfort with the use of the sensor. This can make more and more diabetes patients convenient. Negative of this is it must be replaced once every 14 days and needed to be scanned at least every 8 hours.
Metformin allowed the body to use insulin more efficiently, but it also has a negative impact on the economic. It's quite expensive. One metformin tablet is 500 mg, and maximum daily dose is 2,000 mg per day. The patients have to eat 4 tablets per 1 day. One tablet of metformin is about $0.78. Each patient has to spend about $1,138 to eat metformin to keep them stay healthy. And that's pretty expensive for a low-income family.
Insulin injection is diabetes symptoms, but the syringes used to inject insulin are made of plastic, a material that is difficult to degrade and contributes to global warming.
Diabetes affects Singapore socially, economically, and environmentally. Although diabetes patients can't be cured, there are still many science and medical ways like the freestyle libre system to solve these problems.
Diabetes have already affected Singapore's citizens' economic a lot, because to use diabetes medications to relieve diabetes have to cost a lot of money. Diabetes also affected Singapore's GDP.
As the patients are taking medicine, there will be a negative impact on the environment. Medicine can cause large-scale carbon emissions, water depletion, pollution, and biodiversity loss.
In general, diabetes is a huge problem in Singapore, but we still can't completely cure diabetes.